Hey guys, welcome back to another episode of Life of a Psych NP. I'm Darty, this is my student Paul, and today we wanted to give you a special video because he's ending his rotation pretty soon, and I wanted to kind of give you some perspective in regards to his experience as FNP during his clinicals compared to a Psych NP during his clinical rotation also. So I am going to ask him a few more questions, but if you don't know already, let me have him introduce himself.
Hey guys, my name is Paul. Let's see, last year I did FNP. I took my the board and I passed it, and then I made a little transition and decided to become a psychiatric nurse practitioner. So yeah, I started the program last year, and then I'm almost done. In about 3 weeks I'll be done with my program and finally going for a psychiatric nurse practitioner. So that's a brief introduction of myself.
Perfect. So I wrote down a few questions that I wanted to ask you, Paul. Just wanted to know your experience and what you can do to give comparison between the two programs, because a lot of people are always on the fence. Should they choose the FNP program or should they choose the Psych NP program? And I was hoping you could answer these questions. Alrighty, so the first question is, how do you compare your Psych NP program to your FNP program? Just generalized question.
Okay, let's see. It's actually a tough question, but in the specialty track itself, they're just a completely different, I guess, like, you know, aspect and direction. FNP is more in general, like health and physical, but also they do treat some of those psychiatric patients, but not in like complicated patients. And typically, they try not to initiate psychiatric medications, but they typically refer those patients to psychiatrists and psychologists. Of course, in this like psychiatry, as a psychiatric nurse practitioner, you will be providing direct care, and you will be initiating, maintaining, and yeah, just providing entirety of the psychiatric care. I guess that's the main difference. Yeah. Okay.
Okay. So what do you think are the main things you like and dislike about the two programs and the two specialties?
Okay. So once again, it's all about those are programs I completed for FNP and psychiatric nurse practitioner program, which I'm in at the moment. So it really depends on the person and then the school. With me, I didn't really have much issue with the school that provided FNP program. Of course, there's like pros and cons. I guess the biggest strength about that school was very flexible, providing good audio and visual information, and I think they provided all the information we needed as a student and to become successful, I guess, in the first year of career. With my current program in school, they do a very similar thing. They do provide all the things that you need, I believe, as a first year psychiatric nurse practitioner. At the same time, it's really difficult to make that comparison, because the FNP program I did from A to Z. This school I'm in at the moment, basically I'm doing postmasters or postgraduate certification programs, so it's really difficult to make that comparison. But I feel that it's a little disorganized.
Yeah.
So yeah, it takes more time and effort on my end to complete tasks and homework and all that stuff. But hey, I'm almost done, so I'm just so glad.
Yeah, of course. And with any program that you choose, you have to be able to decide what's going to be best for you, especially when it comes to the organization piece. Obviously, I went to one school. I didn't go to two different schools because I only specialize in psych, so I kind of just saw that thing. But when you talk to a lot of these FNP students, Psych NP students, they always do talk a lot about the organization standpoint, especially people that are going to get their postmasters or their postmaster certificate, and they talk about how it can be disorganized at times. But when you're kind of comparing the two subjects, so obviously there's FNP and then there's a psych component, which one did you actually find more difficult to get a hold of?
So before I started FNP program, I worked as an RN for quite some time. I had experience in nursing, skilled nursing facility, psychiatric hospital, and been working in cardiac step down for some years. So I had some experience in the medical side of nursing as well. So when I was taking FNP, there are a lot of things that I could apply, and I felt like I'm putting more information and knowledge on top of things that I know and learned before and experienced before. So there is some relevancy there. So although I'm not going to say it was easy, but I think it was a little easier for me to complete the program. At the same time, I think they require a little more clinical hours.
Which one?
FNP program.
Okay, so that one's a little bit more difficult, or
so
more
I think
difficult or easier?
I guess slightly easier, in a way, just because I was familiar with a good amount of information already.
Oh, okay.
Yeah, especially in regards to those cardiology and some of the medical conditions. With this current program, although I worked in psychiatric hospital before about 4 years, it's a while ago. First of all, and second, it's so much different. I think as an RN and as a provider, I think the role in psychiatry, those are just so different. So I think it was a little more difficult for me to make that transition, I think, and interviewing the patient and providing those supportive therapy and stuff. It was more efforts that I had to put in to improve myself. I think I'm still trying to improve myself.
Yeah, and I think what you're saying is really important to kind of let the audience know, especially when it comes to having experience in whatever you're doing, just because you're building on top of the knowledge. A lot of people talk about how we get so little hours during our clinicals, but they don't necessarily take into consideration our experience as RNs and how we had to go through nursing school, have clinicals there, and then just building on top of our knowledge. People don't necessarily always incorporate that, especially when they're trying to argue against us. So it's good that you're able to relay the message. So would you say that if you had experience, or if you had your RN experience closer to when you started the RN or the NP program as a Psych NP, do you think that would have been more beneficial? Because you're away from psych nursing for about 4 years. Do you think that would have been beneficial for you, closer to your program?
I think yes and no. If I continued work in psychiatric hospital and chose to go for a psychiatric nurse practitioner program, I think the transition would have been a little easier and more relevant to what I have been experiencing and learning. At the same time, I think it was also a great opportunity for me to learn like medical side of nursing, and going through FNP program, learned a good amount of physical assessment skills and this medical diagnosis and medical problems that can kind of mimic and cause illnesses in psychiatric conditions. So I think it was a great experience and opportunity for me to going through the FNP program and learn those stuff, and then moving on to psychiatric nurse practitioner program. But I think it really depends on each individual. But for me, I think although it happened kind of accidentally, I think it was a good choice that I had the FNP program and then it's like this current program.
So would you recommend, so you have experience in both the psych side and the medical side, and obviously your FNP and now becoming a Psych NP, do you feel that getting experience on both the psych side and the medical side is going to make you a well-rounded Psych NP?
That also, I think yes and no. Yes, because I think it will give you a little more insight into medical problems, because there are a lot of individuals with medical conditions.
Also, similar to what you were saying earlier about understanding how one mimics the psychiatric disorders?
Right.
Okay.
Yeah, and at the same time, individuals with chronic medical conditions, they have tendency to be more depressed and develop more anxiety compared to those with non-medical conditions, and vice versa. Individuals with psychiatric conditions also has more tendency to become or develop those medical conditions like hypertension and diabetes due to some of the variety of issues. So I think understanding the whole a person as a whole, I think it will give us more insight about the person, and then become able to provide really well-rounded care. But that also really depends on the individual and the person. So yeah, but for me, I think it was a good experience having both programs. Yeah.
And that's amazing. I think eventually I do want to do the FNP program and kind of get that background knowledge. Obviously I was in the ER, so a lot of the things that I deal with now I can understand, I have a good grasp of things, but then I just want to kind of take it to the next level, which is I'm sure that you're going to be able to understand and take it to the next level, and that's what I'm lacking. But at the same time, in my roles now, I don't necessarily need it, but I feel like it would be beneficial just for the whole person, just to be able to provide the highest quality of care. So definitely a good thing there. So kind of the last question that I have for you is, if you were going to do it all over again, would you do it the same route that you did it, or would you choose a different specialty first? And if so, what specialty?
Oh, I think I would have done Psych program. Yeah, I mentioned about all those good things if you do both programs, but once again, there are specialties out there because good reasons, right? So when you become a psychiatric nurse practitioner, you're more focused on psychiatric conditions, and that is the right thing to do, because you're not going to provide those medical treatments anyways, and vice versa. Those FNPs, they're not going to provide psychiatric treatment
to a certain extent, right?
Yeah, just like a certain extent, but not in depth. And also they're not going to treat those complicated cases. So I feel that it is not like required or necessary to go for one and then another one and experience both. Although they can potentially provide more benefits. Yeah. So. But for me, I think I would have done PsychNP directly from that.
He didn't want to listen to me, that's why.
Yeah,
I told him from the very beginning, just do Psych, but he didn't want to listen to me.
Yeah, it took me a little more time, so another 2 years and a half. So yeah, during the time, probably I would have become a psychiatric nurse practitioner a while back. So that's one thing I'm missing. But I believe that things happen for a reason. So
exactly, we're here now. And I actually do have one more question. So you went through the FNP program. There are a lot of people that are in Psych that want to go FNP route because they're generalized and they have a good sense of being able to take care of everyone. But some of them want to stick to some Psych, and I know there's some FNPs practicing in Psych. How long was your portion of the Psych component in your FNP program? Or was there even any?
We had some, but not extensive. I don't really recall exactly how much and how long, but it was a very small portion, I think. As I recall, it was a pretty small portion that we learned. So we could kind of rule in and rule out, so we can make appropriate referral to each specialty.
Okay,
yes.
so not that much then. Would you be comfortable with treating Psych if you were just an FNP?
No.
Okay.
Yeah. I'll be comfortable referring the person to psychiatry.
Okay. No. And that's kind of how we are now. I think back in the day, a lot of the providers would have to try to treat everything. The good thing about now, well, not the good thing, but then there's more liability. So that's why a lot of general practitioners tend to refer out to specialties and just have specialty people treating that specific specialty, which is helpful for the patient. But I can definitely see that a lot of the FNPs that I talk to, similar answer is they don't necessarily get as much exposure. You weren't even allowed to do hours in psych at all. I know as PAs you do get hours, but then as FNPs you're not allowed to get hours in psych in general, so it's kind of crappy in that sense. Well, thank you, Paul, for explaining all of this. A lot of my audience wants to know this because they're always up in the air whether they need to choose the FNP route or they want to choose the psych route because they don't want to pigeonhole themselves in just one specialty, as opposed to FNP where you can work in so many different areas. And I just wanted to show you guys that his opportunities, his opinions, and I just wanted to kind of give you some more information straight from a student. So I'm glad you're able to do that. Thank you, Paul. I appreciate that.
Always
and I
a pleasure.
appreciate you coming on my channel, and good things ahead for this guy. He's going to do an amazing job as a FNP and a Psych NP. Alrighty, as always guys, make sure you like this video, make sure you subscribe, and if you haven't followed me already, follow me on Instagram at LifeofaPsychNP. Have a wonderful day guys. Bye.
Bye.